create the imbalances that we have today.
COVID-19 has laid bare the systemic social inequities. Addressing these larger problems must become our priority.
We have to make sure that the economy actually works for the people.
It's not just about growth for growth's sake, but how we share that prosperity.
It is not sustainability or profit, it is profit through sustainability.
We have to reskill our people to be successful, and if they're more prosperous, the companies are going to be more prosperous.
The most important tools are the education and technology.
Technology creates opportunities so that people are able to move to greener industries.
It's not about not knowing that we are in a climate emergency. It's about choosing to take action.
For that, we need to act decisively in the support of renewable energy.
The science is very clear today that the sustainable path is more attractive.
We can focus on the short-term benefit, or we can look further to solve bigger issues.
We need unprecedented collaboration to create systemic change.
It means redesigning the instruments we currently have
on a completely different trajectory, and that doesn't leave anybody behind.
We are one community, and we have to remember that.
Good afternoon and welcome everyone. My name is Michelle Hussein from BBC News, and it's my privilege to be chairing this panel discussion at Davos 2021, one of the very final ones at the end of a very busy week, albeit a virtual rather than a physical week of gathering. We're going to be looking at the lessons of the pandemic response and asking what they should teach us about future healthcare and future collaboration. COVID has brought some of the world's most advanced health systems near to collapse. Elsewhere too, it has disrupted hard-won public health gains and the delivery of vital services. It has, however, shown us what collaboration and public-private partnerships can achieve and what is possible in record time when a public health emergency demands it. So how do we make the most of what we have seen in the last year, and how do we apply it to COVID in 2021 and also to other health imperatives? And how can we maintain a spirit of joint enterprise in the face of tensions that we are seeing at the moment on vaccine supplies? Let me introduce first our panel. Delighted to have two ministers joining us. Ine Eriksen Søreide has been Minister of Foreign Affairs of Norway since 2017. Previously, it's Minister of Defence. Norway is one of the co-chairs of the ACT Accelerator Partnership, which is working on equitable access globally to COVID, testing, treatments and vaccines through the COVAX initiative. Welcome, Minister Eriksen Søreide.
Thank you.
Thanks for being with us. Also, Jens Spahn, who's been at the forefront of Germany's pandemic response as Federal Minister of Health, a post that he's been in since 2018. And he was also recently appointed as a deputy leader of Chancellor Merkel's CDU party. Welcome, Mr. Spahn, to you as well.
Thank you for being with you tonight.
Dr. Albert Bourla has been Chief Executive Officer of Pfizer for 2 years. The vaccine it produced with BioNTech was one of the very first to be approved by medical regulators. And also in this WEF context, he is a co-chair of the World Economic Forum's high-level task force that is being launched today with the goal of accelerating public-private partnerships for epidemic preparedness and response. Welcome, Dr. Bourla.
Thank you very much for having me.
And also Richard Hatcher, Chief Executive Officer of CEPI, which also works on epidemic preparedness. It was launched 4 years ago at Davos in the light of Ebola, MERS and SARS, with the task of helping to develop vaccines for future epidemics and making them accessible. And just last year at Davos, it made its first COVID vaccine-specific investments. Before that, it had already made investments that had a bearing on what we're seeing today, including on funding technologies such as RNA. So a warm welcome to you as well, Dr. Hatchett.
Thank you, Michelle. Nice to be here.
To everyone watching on different platforms, please do use the opportunity, whatever platform you're on, to send us your contributions, your observations, your comments, your questions, and I'll try and bring them in to our discussions. But first, before we hear from the panel, we're also joined from Geneva by Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization. It's very good to have you with us, Dr. Tedros, for some opening remarks to help set the scene of where we are at this point in time. Tomorrow it'll be exactly 1 year since you declared COVID to be a global health emergency. Take us then to your thoughts today, and particularly you might have about how we can apply the lessons of the pandemic beyond COVID, and any concerns you have about whether we might be seeing some vaccine protectionism or maybe even nationalism now.
Thank you, Michelle. And Minister Soreide, Minister Spahen, Dr. Borla, and Dr. Hatchett, dear colleagues and friends. Last year, I had to leave Davos, that was January 22, actually, 2020, after the first day to open the WHO Emergency Committee, which was considering the outbreak of the novel coronavirus in China. Tomorrow, as Michel said, marks 1 year since, on the advice of the Emergency Committee, I declared a public health emergency of international concern over the emergence of the novel coronavirus. At the time, there were fewer than 100 cases and no deaths reported outside China. This week, we reached 100 million reported cases. More cases have been reported in the past 2 weeks than in the first 6 months. The pandemic has exposed and exploited the inequalities of our world. There is now the real danger that the very tools that could help to end the pandemic, like vaccines, may exacerbate those same inequalities. During the H1N1 pandemic in 2009, safe and effective vaccines were developed. But by the time the world's poor got access, the pandemic was over. 9 months ago, WHO, CEPI, and Gavi came together, supported by Germany, Norway, and other partners, to form the Access to COVID-19 Tools Accelerator, including the COVAX vaccines pillar. The ACT Accelerator and COVAX were conceived with 2 aims: to develop vaccines, diagnostics, and therapeutics fast and distribute them fairly. The first aim has been achieved. The development and approval of safe and effective vaccines less than a year after the emergence of a new virus is a stunning scientific achievement and a much needed source of hope. Whether the second aim can be achieved remains to be seen. As we speak, rich countries are rolling out vaccines to their citizens, while the world's least developed countries watch and wait. This not only leaves the world's most vulnerable people at risk, it's also short-sighted and self-defeating. Vaccine nationalism will only prolong the pandemic. The restrictions needed to contain it, and human and economic suffering. A new study by the International Chamber of Commerce Research Foundation shows that vaccine nationalism could cost the global economy up to $9.2 trillion, and almost half of that, 4.5 trillion, would be incurred in the wealthiest economies. By contrast, the financing gap for the Access to COVID-19 Tools Accelerator stands at $27 billion. The Secretary General of the International Chamber of Commerce, John Denton, described fully funding the ACT Accelerator as a rounding error compared with the massive stimulus packages implemented in G20 countries. If fully funded, the ACT Accelerator would return up to $166 for every dollar invested. Many businesses have global operations that depend on global supply chains. In our global village, if the virus continues to circulate, those operations and supply chains will continue to be disrupted and the economic recovery will be delayed. If we lose trust in international collaboration through vaccine nationalism, we will all pay the price in terms of a protracted recovery. We are asking those governments that have already received deliveries of vaccines to vaccinate their health workers and older people and share excess doses with COVAX so other countries can do the same. But we also understand that governments are under political pressure to vaccinate their populations. I therefore ask the business community to use your influence to convince governments that sharing doses is the best way to control the pandemic globally, restore confidence, and reboot the global economic recovery. The COVID-19 pandemic is a powerful demonstration that health is not a commodity or a luxury item. It is a fundamental human right and the foundation of social, economic, and political stability. Yes, we must work together to end the pandemic, but we must go further. There can be no going back to things as they were. Together, we must invest in a healthier and safer world. And a healthier and safer world is also a more productive and prosperous world. This is not an endeavor for governments alone. The public and private sectors must work together. We have good examples from the past year. In our collaboration with Facebook, Google, and the world's major media platforms to fight misinformation, in the collaborations to develop and approve safe and effective COVID-19 vaccines fast and distribute them fairly, and in our creation of the Solidarity Response Fund and the WHO Foundation innovative efforts to mobilize support from the private sector for pandemic response and global health. My colleagues, we face a huge challenge in the coming weeks. We must ensure that vaccination of health workers and older people is underway in all countries within the first 100 days of this year. We've just 71 days left. Time is short. Every moment counts. I thank you. And thank you, Michel, and thank you also all panel members. I have another urgent issue to attend. I wish I could be with you in the panel, and I hope you will permit me to leave so I can attend the other emergency. And I hope you will understand. But my heart will be with you. Thank you.
Dr. Tedros, thank you very much for taking the time to give us those thoughts. And let me turn first to Minister Eriksen Søreide, because Norway is at the very forefront of the call to support the ACT Accelerator and COVAX. But as Dr. Tedros said, there is the significant funding gap, $27 billion. I mean, he made it clear just how much is to be gained by filling that funding gap. It's not only the right thing to do, but there's an economic imperative.